What's going on, everybody? Here we are, Urban Wall Street, Earl Christian III on location. About to go in here and talk to Dr. Randal Pinkett, CEO and founder of BCT Partner Group. He's just secured $1 billion in contracts from the US government for health and human services to provide IT solutions. So we're going to go talk to this brother, find out about these contracts, and see how it's going to benefit you. Keep watching, stay tuned. Greetings, everyone. Earl Christian III, Urban Wall Street. I'm sitting here with an amazing gentleman. We have some amazing news. The brother's been doing some phenomenal things. You've seen him before. His best-selling book. He had an amazing book tour, Black Faces in White Places. But if you're still unfamiliar, I'm not going to hold it off any longer. I'm sitting with my brother, Dr. Randal Pinkett. Brother Pinkett, how are you, sir?
I'm good, brother. It's good to see you again, man.
You too, of course. So listen, first I want to say, man, congratulations.
Thank you.
You're making some major things happen, and we're going to talk about these $1 billion contracts you just secured. So first things first, how do you even know that these contracts are out there to secure, Randal?
Yeah, so the good news for BCT Partners is that we just landed 2 very large contracts with the U.S. government, a $900 million contract and a $20 billion contract. We made the decision back in 2009 that we wanted to get into the healthcare industry. We were looking at the reports, looking at the forecasts, and all indicators are that healthcare is going to be big business. In fact, the numbers suggest that it will be 20% of the U.S. economy by the year 2019. That's about 1/5 of every dollar spent in the U.S. will be spent on healthcare. It's an astounding number. So we said we want to get a part of that. So we made that decision in 2009. 2010, the government issued a request for proposals for the first contract with the National Institutes of Health, NIH, within the US Department of Health and Human Services. We heard about it through one of our partners, and there's a lesson here which I'll talk about, who had already been scouting the contract. It was larger than what we would have normally looked to pursue. But the way the contract was structured was that there was a large business contract and then a set-aside portion for a small business. When they brought it to our attention and we realized there was a small business competition, we said, that's something we could go after. So we worked with the partner, the company is called Delta Solutions, to pull together a proposal to submit the bid. And then the next year, 2011, another department, the Substance Abuse and Mental Health Services Administration, under HHS, also issued an RFP for this $900 million contract. Same structure, a large business piece and a small business piece. We went after that in partnership with Delta once again. And then by pure coincidence, a couple months ago, we got notice from both organizations that we won both contracts.
I can only imagine, you know, once you hung up that phone call or finished that email, just that immediate sense of
madness, euphoria, insanity.
Yes. Without question, you're like, oh, I'm doing it. If I've done anything to this point that I feel accomplished, this is the cream of the crop right here.
That was a milestone for us as an organization. And, you know, we made that decision 3 years ago.
Right.
But, you know, again, there's a lesson there. And let me paint the picture more clearly.
Yes.
When we actually submitted the proposal, what we did was we partnered with 7 other companies because it was too large for us to cover all that territory. And had we submitted the bid on our own, the government would have said, you can't handle this.
Right, it's not ready for this.
So we bring these 7 companies to the table to kind of plug holes, fill gaps, and create and tell a comprehensive story. And I think that's a lesson for business owners, that you can do more together than you can do individually. And more specifically, had it not been for the fact that we partner with other organizations, we'd have never even been in the running to win these opportunities, and that's a lesson.
You know, and it is a lesson, and it's so poignant that you said it, because a good colleague of mine, a business partner, William Patterson, he's my wealth coach and CFO, and he always told me, he said, any situation of lack can be satisfied through a partnership.
That's right.
And I've lived by that. And what you said just hit it on the head, because a lot of people think, you know, they try to do things on their own. And the reality is, you may have the mindset, the wherewithal, the vision to make it happen. But at the end of the day, two heads are better than one.
Always.
And at the magnitude that you're talking about, it's much easier and more conducive and effective to have other individuals, because even if you can still do it, there might be something that you'd miss that individuals who have more experience in that area can definitely add to the team. So I love that you said that, because I live by that. Any situation of lack can be satisfied through a partnership. Remember that.
And you know, we live in what I describe as an era of consolidation, and by that I mean we're living in an era where we're seeing big companies getting even bigger. You think about United and Continental coming together, AT&T and Singular, Bank of America and Wachovia, Wells Fargo and I mean, there's all these entities that were already big, and that are now getting bigger. And when you think about Home Depot or Walmart or all these large multinational organizations, and here you are with your 50-person consulting firm, and thinking that you're in competition with that person who's got 10 on their team. You have every incentive, if not now, every imperative to figure out how you can work together, because the fact of the matter is, not only the big getting bigger, but as a function of that, it's making it harder to compete when you're too small. And if you, to your point, if you specialize in certain areas, you got to find folks that can complement that can allow you to have more capacity to go after opportunity to compete against what are already very large and entrenched organizations. And that's what we did on this contract.
Excellent. Now, you know, a lot of people, you know, may not understand the magnitude of what it is. So we're going to be a little bit more layman. Exactly, Randal, what position does this put BCT in, and who is are there a primary audience or a primary demographic that you see where BCT's, how should I say, accomplishment in this area and gravitating and capturing these grants is going to help you benefit?
So, I mean, these are by far the largest opportunities we've ever secured. And these are respectively 5-year and 10-year contracts. So there's, you know, a certain measure of longevity that is built into landing these kinds of opportunities. Now, you can't do what some companies do and end up being solely dependent on these opportunities as your sole basis for growth. You know, a lot of companies will land large opportunities, and then when those opportunities go away, which inevitably everything at some point is going to go away, they're left high and dry. So while we're going to do everything we can to capitalize on these opportunities and to allow them to be a springboard to take us to another level, we don't want to get caught in just rallying solely around these so that we're solely dependent, so that 5 years or 10 years from now, we're having a different conversation, which is, okay, so what are you doing now? And I say, well, I'm not doing anything.
What's the first step for BCT in with regard to implementing? Because where do you begin to implement? You're providing the health and IT services.
Yes.
To whom?
Yep. So I'll break that down for you.
Okay.
The two contracts are similar in that they both deal with healthcare, but through two different lenses. The contract with NIH, National Institutes of Health, is a government-wide IT solutions contract. So any government agency can purchase IT solutions off this contract. And so here we're talking about things like mobile applications to get access to your healthcare records. We're talking about the ability for healthcare providers to have systems that are interoperable, so that you're not having to bring your health records to this provider and then that provider and then that provider, but rather they're all tapping into the same database and getting the most up-to-date information on your health records. Excellent. And we're talking about things like electronic health records, where you're digitizing health records, making them web accessible, mobile accessible, and in doing so, making sure you're compliant with things like the Health Information Portability Act, so that they're secure. Nobody who shouldn't have access to your health records doesn't have access to your health records. So that's the NIH contract, and so we're going to be providing IT solutions that are kind of 21st century. The SAMHSA contract, Substance Abuse and Mental Health Services Administration, SAMHSA, that is helping both the government and those who receive government funds to deliver better behavioral health care. And by behavioral health care, I'm talking about things like substance abuse, dealing with alcoholism, drug addiction, mental health issues. And as these healthcare providers who are funded by the government deliver these services, we're working with them to help them do that better by conducting research and evaluation to identify best practices and provide what's called technical assistance and training to work with their staff so that they can do a better job of delivering those services. So we'll be dispatching our consultants across the country working with both the federal agencies who need IT and the behavioral health care providers who need better assistance. And the first step for us is standing up what we call a program management office, or a PMO, and that's a very fancy way of saying a staff of people to manage all the interdependencies and the complexities of both of these contracts.
Excellent, excellent. I love it. So let me ask you now, we just had, the president just had a major win with regard to his Obamacare being upheld.
Yes.
Does the contracts that you've secured, will they be complemented by the Obamacare?
Absolutely. Not only complemented, but in some ways fueled by Obamacare. The Obama administration has invested $15 billion into the Affordable Health Care Act, known as Obamacare. The lion's share of that money is situated in the Department of Health and Human Services. The second largest allocation is to the IRS, because the Affordable Health Care Act has provisions that are going to impact how we file our taxes, especially for businesses, how they file their taxes. So when you think about the fact that we've got two contracts with HHS, who's receiving the lion's share of $15 billion investment in the Affordable Care Act, you can rest assured that when you think about how the government is attempting to streamline the delivery of health care, engender cost savings in how health care is delivered, how do you achieve those efficiencies? Well, it's through better organizational practices and oftentimes through better IT. And so it's almost inevitable that we will be engaged in some way, shape, or form as the Affordable Care Act is executed to be working with government and those receiving government funds to ensure that health care is being delivered efficiently and effectively on behalf of the Affordable Care Act. Okay.
So now, I want to understand it, for my individuals who may not be as, up to date and understanding, IT and what's going on. The reality is, a lot of times we go to the hospitals. I'm just give me an example. We go to the hospital and we have to fill out paperwork.
Yes.
And then if you happen to move or go to a different hospital or center that's even in your same city, you have to fill out the whole paperwork again, your last doctor you've seen. So I'm assuming, just from seemingly with these type of IT solutions in place, they're not necessarily to benefit their patient. Indirectly are, but is it more so for the hospital to be more efficient, so the previous hospital or doctor can simply email a file over, so you don't have to go through all of the paperwork and the reiteration?
It's both. I think that the next wave of healthcare service is going to empower the patient to have access to their information more so than ever before. I think the next movement is going to be giving you access directly to your information via your mobile phone or your computer or online, and giving the healthcare providers access to the same information, so it's not redundant, it's not duplicative, and you aren't having to enter it in several times, but just once, that you access it and all your providers access to it. It's going to be much more patient-centered healthcare than ever before.
And it sounds like it's going to give individuals an opportunity to be more accountable, have personal accountability for their health records.
Yes.
And access.
Yes, and keeping them up to date.
And definitely keeping them up to date. So what do you think is going to be the greatest impact that these contracts, or not even the contract's impactful, the money is one thing, it's the execution of the contract. And what do you think is going to be the greatest impact for the people that are receiving the services? The medical practitioners and the health care providers, they're getting in more efficient technology, but what do you think is going to be the greatest impact for, progression?
Yeah, I think it's going to empower individuals to take greater charge of their healthcare outcomes. I often draw the analogy of owning a car to being a human. If you don't know anything about a car, people can take advantage of you. Things can break, and you're going to end up paying more to have it fixed because you didn't know. And if you don't have a real basic level of comfort with what the basic workings of a car are, you're not going to get the most out of that car. The same is true for your own health. And while doctors are the experts, at the end of the day, you are responsible for making the decisions of what's best for you. That's why you get second opinions. That's why you go and get referrals. That's why you vet who you want to be the provider of your health care. And I think the way that you do that is by having good information. And that's having up-to-date information at your fingertips, readily available, and that technology is one of the drivers for being able to give you the tools that you need to make the best decisions. And I'm hopeful that this work will ultimately achieve that goal for regular folks who have real healthcare needs, that they can have better outcomes because they have better information.
Right. So the beautiful thing, so this is nothing that individuals don't have to necessarily do anything. Do they need, how can people become abreast or aware of it? Is it going to be when they go to the hospitals, are they going to know about this? How can people find out more about this situation, the grants, and how it can benefit them and how it's going to benefit just their community at large, so they know how to, take advantage of it for themselves, but also how to disseminate that information effectively to other individuals in the community?
Yeah, I think the Obama administration has done a really good job of providing information on the status of the Affordable Health Care Act, and I believe that their intent is, as the act is being implemented, giving residents, consumers, citizens up-to-date information on how it relates to their everyday lives. So I would encourage them to go to the White House's website and to stay abreast. You can probably sign up on Twitter, on Facebook, online to get email alerts. Take your pick, whatever's most convenient to you. But be an informed citizen. Know what's happening with your government. Know what the government's trying to do for you, so that you're taking advantage of it. I would hate to see $15 billion invested in the Affordable Health Care Act, and you don't know anything about how that is or is not benefiting you.
Exactly.
So again, that responsibility is on us. The information is there, and we live in an age where we're overloaded with information. The fact is, we have to take responsibility for seeking out the information that can empower us.
Very, very true. So before we wrap it up, when do you anticipate this technology being implemented into the healthcare facilities or the healthcare industry?
I would say we expect to see some tangible outcomes of the work we're doing in early 2013. We're just getting ramped up now. We expect to be kind of fully up and running by the fall, which means by the early part of 2013, we hope to be able to have some tangible examples of some solutions that we've delivered that folks can benefit from.
Excellent, excellent. Well, I know you've got a busy day. We all have a busy day. But if there's anything I haven't asked you, Randal, there's always things that you want to say, to get across to the audience, to get across to people who are going to be beneficial. So if there's an area that I haven't touched upon or a question I didn't ask, but it's really important and you want people to know about the contracts and about just the whole magnitude and where this is going to go in the future, what's the one thing you'd want to tell to the people?
The only thing I would say that we haven't talked about, or maybe we did talk about, is, as we think about the healthcare landscape and all the money that's being poured into healthcare reform and the like, it's going to take a while for the real transformative changes to take place. But I believe with the Affordable Care Act, which is providing affordable health care to all Americans, which is it's a real milestone in the history of our country. No president has ever been able to accomplish providing affordable health care for all Americans. I mean, Clinton tried it unsuccessfully. Bush didn't even go there through his administration. And to his credit, President Obama has successfully done that. So I'll say be patient, no pun intended. Yes, be patient as these changes take place, but also don't just sit on the sidelines. You've got to be an advocate for your representative, for your senator, for your local elected officials and the like, to let them know that these are the kinds of policies and programs that are important, which means if you believe that they're important, you have to support the legislators who are behind those, which means, from my vantage point, it means getting out to vote this November in the fall election, because it's a very real possibility that if the wrong leaders are elected in the next election, that all of the gains we've made over the past 4 years could be lost. Yes. And so while we had a lot of excitement 4 years ago, for understandable reasons, I'm concerned that we may not see the same level of enthusiasm here in 2012. We've got to make sure we get out to vote in 2012. That's the last thing I'll say.
Beautiful. Brother Randal, it's always a pleasure talking to you. And I know we're going to continue talking. Absolutely. Again, congratulations with BCT Partners and making this thing happen. I look forward to greater things. I know this is just the tip of the iceberg. Someone would say, if you just secured billions of dollars in contracts, how big can you get? You can get trillions of dollars in contracts, right, brother?
Well said.
It's always a beautiful thing.
Conversation.
Yes, sir. Yes, sir. Urban Wall Street, like I always say, we want to bring you the best and the brightest. Dr. Randal Pinkett has been doing some amazing things. You saw him do this thing on The Apprentice, and now he's making amazing situations and strides going to happen with these contracts from the government in health and human services. So take advantage. Be proactive in your education. Be proactive in your future. Be proactive in your health. And most important, like he said, your lives dependent on it. We really must be accountable and responsible for ourselves. When November comes, represent yourself correctly. Be accountable for yourself, to our country, to our president. Make the right decision so that you you can continue living the lifestyle you want, have the lifestyle you want, and know that you have people in place that are working fervorously to provide you with the services and opportunity that you well deserve as Americans. As I always say, be mindful, be prosperous, be smart, do your diligence. Until next time, peace.